Hello, I am Colonel Brodus H. Hartley Jr. I am the President and CEO here at Community Health of South Florida. We are so pleased that you have chosen us as your healthcare team, and we will do everything to exceed your expectations. Here at CHI, our motto is patient care comes first, and we take it very seriously. We are designated as a Level 3 patient-centered medical home. It's an award given by a national agency that says we are providing the best and highest quality care to our patients. It also means that we strive to make sure you have the same team of doctors and nurses each time you visit us here at CHI. They will get to know you and your family, and you will get to know them. CHI operates in a one-stop shopping model. That means we have a lot of services all under one roof. It's a model designed with your convenience in mind. Spend the day with us and take care of several appointments all in one day. We have everything from primary medicine, pediatrics, OBGYN, women's services, mental health, dental, radiology, low-cost pharmacies, and much more. As I mentioned, we want this to be easy and convenient for you and your family. That's why we have 9 health centers and 42 school-based centers. Our healthcare centers stretch from Marathon in the Florida Keys to Homestead, South Miami-Dade, and into South Miami and Coconut Grove. We want to make sure you have one of our centers close to your home. We also want to make sure transportation is never a problem for you. That's why we have a fleet of buses that will pick you up and take you to your appointment and take you back home afterward. And the ride is free. We also have free prescription delivery. Just ask your pharmacist to send your medicine directly to your home. CHI has been around for more than 40 years and is built on community outreach and caring for everyone. We accept most insurance plans, and if you don't have insurance, one of our specialists can help enroll you in the right plan. We also offer affordable care with a sliding fee payment scale that is based on your income. Here at CHI, we truly value your feedback. I want to know all about your visit. So before you leave, please visit one of our computers located throughout our health centers. I will personally read your feedback and make sure that we are providing the best possible care. Now enjoy the CHI News Show. It is a program that we produce right here at CHI. We believe that an informed patient is a healthy patient.
Coming up on CHI News, when you're sick, you want instant relief, but we'll tell you why antibiotics are not always the answer. Plus, are x-rays safe for your children? We'll examine the controversy. And it's a labor of love. Learn how some families are getting trained at CHI to make a difference in the life of a foster child. You're watching CHI News. Hello and welcome to CHI News. I'm Tiffany Helberg. We begin our show today with a story about lessons of love. Every year, a select few families sign up here to be foster parents. It is not an easy process. In fact, there's a huge learning curve for both the parents and the child.
Did you eat lunch at school?
It's been a rough day at school for this 7-year-old. He's not used to being in class on a regular basis, and one could argue he's certainly had a rough life so far.
How much does your belly hurt?
His foster mom does her best to read him, but like many foster children in CHI's Therapeutic foster care program, he has difficulty expressing himself and sometimes builds an emotional wall between himself and others.
But they don't want to get hurt one more time, so they try to build a wall between you and them, so sometimes it's hard to break through.
But Martha Cook has had a lot of breakthroughs during the 3 months that she's had this little one.
But the first night that he slept here, he just told me, I never had a bed this good. Go like, well, this is your bed. This is all your bed.
And now bedtime is a very special time in the Cook home.
We put him in bed and he's like, brother haven't given me a hug and a kiss. Amanda haven't given me a hug and a kiss. Mom, can I have another hug and a kiss? So sometimes it's just like 10 minutes going back and forth. Everybody giving hugs and kisses because he wants that attention. He needs that nourishing.
Cook is a foster parent in CHI's Therapeutic Foster Care Program, a program that is much different than traditional foster care.
We only do therapeutic foster care, which is a little bit different than traditional foster care. Because with therapeutic foster children, those are the children who were at a traditional level, but for whatever reason, based on their behaviors, their mental health issues, they needed an enhanced placement. So this program was created to provide really temporary stabilizing program for these children so that at some point they can either go back to regular foster care or be reunified with a family member.
Marie Alcinius is the licensing compliance manager for the program. She says in the past couple of years she's helped to place more than 30 kids in therapeutic foster homes.
How about if I give you a plate of soup? You want soup?
Alcinius and her team do more than just place these kids. They provide specialized training for the foster parents, in-home comprehensive care, and a variety of mental health professionals to treat the child.
It's very fulfilling for me because I absolutely love what I do. I've been doing foster care for the past 7-8 years, and it's really wonderful to work with the families, to see when we place the correct children with the correct family. So it's very rewarding.
She's trained Martha Cook as well as two of her biological children, 20-year-old Lawrence and 15-year-old Amanda. It's a team effort in this home. Otherwise, this single mother says she would not be able to do it.
I think that my kids are rubbing off positively on them. So I really how would I say it? I really depend on my kids to be like something positive to them and to be a good example.
It makes me feel good because you just, like, you always want to be that person that's a good influence for somebody else, that you can help change somebody else and help them be a better person.
There are times when it can be extremely challenging. For instance, this young man recently had a mental breakdown, throwing himself against the wall and destroying things in the home. Ultimately, he had to be Baker acted and taken to a crisis center. A painful experience Cook has been through more than once as a foster mother.
I usually cry when they get Baker act. Oh God.
Mental health experts say sometimes it is the only way to get the child back on track.
It's hard because it's like seeing your own son being taken away. And you look at their eyes and you can see that they don't want to go through that.
A roller coaster of emotions for the child and the foster family, all so that healing can begin to start. It's a difficult job that requires full-time love and devotion. That's why therapeutic foster parents are not allowed to work, at least one of them in two-parent homes, that is. There are financial stipends, but at the end of the day, for people like Cook, it all boils down to one thing.
It's a call in my heart, something that I really wanted to do. I like taking care of kids, and I like being a mother.
Therapeutic foster care program is designed as a temporary transitional program. However, there have been cases where the families have permanently adopted the child. For more information on the foster care program, just call this number, 305-763-2410. Sometimes just managing yourself can be a tough task. That's why CHI's clinical pharmacy program can be a valuable resource. Did you know that CHI's pharmacists do much more than dispense medicines? Working in the pharmacy here at Community Health of South Florida is no longer a job that's done only behind the pharmacy walls.
Okay, I have reviewed your medication chart and your problem list and your med list.
Pharmacists like Tony Bowen McDuffie are now part of a thriving clinical pharmacy program that brings their skills into the doctor's exam room and beyond.
And how many times a day are you testing? Are you testing your blood sugar?
Twice a day.
It's helped Demont Ellis to manage his diabetes.
with their advice and they, concern, make me want to feel, it makes me feel happy.
The clinical pharmacy program is like an extra level of security and support for patients. Sometimes people go to different doctors' offices and forget to fill in each doctor on previous prescriptions. CHI pharmacists look over all the medications to make sure none of them are conflicting. They also make sure the patient's taking the medication properly, and at times they catch critical errors that could have been life-threatening.
We catch mistakes, either the wrong dosage or the medication that's not for the proper disease state.
It's a time where patients can learn and become educated about their disease and medicines.
When I go to them and ask a question, they really explain, take their time to explain and talk to us.
That's one of the joys of pharmacy, helping someone, always feeling that you are there for the patient. You're helping someone to get better, to become whole and be healthy.
For this father of four, the journey to overcoming diabetes has been challenging, but with a little extra help, it's been manageable.
It's a good thing that they there for us. Some of us may not like it, but I need it because I have kids, so I need to be there for my kids.
And the pharmacy has a variety of programs to help the uninsured pay for medications. The folks here at CHI's pharmacy can help you with that too. Do you remember waiting and hoping for your teeth to fall out as a young child, all so that the tooth fairy could pay you that special visit? Somehow that magic is lost as we get older, and losing teeth becomes more problematic, especially when it comes to having your wisdom teeth extracted. For some, the thought of going to the dentist conjures up a scene from Little Shop of Horrors. But that could not be farther from reality.
People don't be afraid to come to the dentist. Most of the people will tell you those wild stories, haven't been to the dentist in years.
Most of us have gotten used to routine exams and cleanings at the dentist, but for some, the smartest teeth in their mouth become the concern. Wisdom teeth can be a common cause of dental problems. They are the third and final set of molars that most people get in their late teens or early 20s.
Some people have small mouths, and the wisdom teeth are the teeth all the way in the back, so they really don't have enough room for them to come in. When they come in partial
wisdom teeth can be difficult to keep clean, causing infections that come and go.
When that happens, they get swollen gums, they actually get pus coming out in that area. Long term, the best would be to have the tooth removed.
Not a lot of people want their wisdom teeth removed because it requires a surgical procedure.
A lot of times we really have to talk people into having the procedure. It's not complicated, but it is surgery.
But Dr. Robert Johnson says not everyone needs to have their wisdom teeth extracted.
No, some people don't have any problem. They keep it clean, there's no infection around it, there's no cavities, there's no reason to have it taken out.
About 10% of the population has their wisdom teeth extracted because they become problematic. It's actually a pretty simple procedure. The patient is fully awake and aware, but anesthesia is administered, so there is no pain.
Just like any procedure where you're going to have surgery done, you'll feel pressure, especially it's a little pressure exerted when removing the tooth. But beyond that, you shouldn't feel anything.
Sometimes people let fear get in the way of staying healthy. And as Dr. Tony Amofa tells us in this next story, fear and lack of information can often pave the way for deadly cancers, such as colorectal cancer.
This is normally what the colon should look like, nice and smooth with no bumps like that.
Those bumps you're looking at are evidence of colon cancer, a killer that Dr. Tony Amofa regularly warns his patients about.
Colon cancer is common, number one. Number two, that if you're in any of those high-risk categories, age older than 50, or you've had family history of cancer, any of those cancer risk factors, please get tested.
Testing can be as simple as this FIT test. It stands for Fecal Immunochemical Test. You can actually do the test at home after you've had a bowel movement.
Take a sample of the water in the bowl, put it back in this container, put it in here, and either mail it back or drop it off in the lab.
That's it?
That's it. Another one is a colonoscopy. That's the one most people are aware of. Colonoscopy is where we pass a tube through your rectum to look into the colon, to look for polyps and other lesions.
I would assume that a lot of patients don't like being tested, having a colonoscopy. How do you overcome that?
Most people aren't comfortable in anything relating to that aspect of the GI tract. However, we do our best to reassure and discuss benefits and risks.
But it's a test that can save your life, and for some people, the risk is higher than others.
There's some families have certain genes that actually predispose them to having colon cancer. But the risk factors include age, right? The older you are, the more likely you have colon cancer. Some racial and ethnic minorities have a higher rate and risk for colon cancer.
Your diet can also predispose you. Eating high fat, high protein, and a diet with lots of red meat has been linked to colon cancer. Smoking is also a significant factor.
And so, colon cancer grows in the colon, and this is the colon. Leads from here all the way to the rectum, right? When you have colon cancer, it shows up in one aspect or the other of this. And if it's spread, it would grow outside of the colon to surrounding tissue or organs like the liver and muscle and bone and that kind of stuff.
It's a slow, silent killer that can be stopped if caught early.
The testing, in large part, with a stool test is simple. And even with the colonoscopy, we can make you comfortable. And that allowing us and working with us to get you tested and treated early can potentially save your life.
And to make things even easier on you, CHI's in-house lab can process that fit test for you right here. We all want the best for our children. So how do you know if giving your child a vaccine is really the best thing to do? Could your child get autism from that vaccine, or could he or she contract the very illness the vaccine is designed to prevent? We examine that issue.
3-year-old Isabella is better than some adults when it comes to getting a shot.
Good girl. Good girl. Done. All done.
And I know as a first mother, it's really hard because whatever you see, when you see in your child and they're putting back the shots and the needles, and it's really scary because you might think, oh, it's hurting me, and how it hurts me, how they feel it was hurting, they're crying. We were very worried about them.
But for some parents, the worry goes far beyond the physical pain of the needle prick.
There's some concerns that I hear about vaccines causing seizures, autism, vaccines actually causing the disease, vaccines causing fevers, vaccine causing rash, and the worst case, vaccines causing death.
CHI pediatrician Dr. Nicole Field says she's heard it all from parents, and most of it is not true.
What vaccines actually do, it boosts the immune response. So when it boosts the immune response, you have those inflammatory cells, those cells that fight infection, go into action.
She says that immune response can produce a low-grade fever or rash.
But the cases where you have the seizures, have the autism, and have death, those are not related to vaccines. Especially the one, MMR is the one that's thought to be associated with autism, and there's no credible evidence that associates the MMR vaccine to autism. It's just a myth.
Dr. Field says the truth is that children really need to be vaccinated. 7-year-old Wilton Benjamin says he's a pro at getting his vaccines.
Like a shot, and I was running a little bit, and then I was calming down.
As children get older, they do get more used to it. By the time a child is 4 years old, they should have gotten 20 vaccines, oftentimes more troublesome for mommy to take.
Now, if they saw those diseases that the vaccinations prevent, they would want their child to be vaccinated, because the great thing about vaccinations is that we don't see those horrible diseases anymore. We don't.
So for Isis Santos, vaccines are a must. Her children's health depend on it. And Santos depends on her pediatrician to guide her in the right direction.
They trust their provider enough to see and treat their child. They should trust the provider to give them the best information possible.
Some parents try to space out the shots and do only one at a time, but Dr. Field says while that might make mommy feel better, it does take longer for the child to get their necessary vaccines.
So instead of them being completed with their vaccine scheduled at 4 years old, it may space it out till 6 and 7 years old. And then there are times where the patients can't be enrolled into school because they need their certain vaccine.
Bottom line, vaccines protect children against diseases, and Dr. Field says they do much more good than harm.
Feel like much better.
It's really worth it. They're nice and strong and healthy. That's why I'm very pointing on their well child checkup when every year they come. It's really important to come with the well child checkup.
You might have also heard about concerns of exposing children to x-rays and radiation. Well, those are not myths, but there is a delicate balancing act that doctors and radiologists weigh when deciding whether or not to x-ray a child. Like many moms, Cecilia was very apprehensive when doctors told her that her son needed an x-ray.
X-ray, yes, because the amount of radiation concerns me. Cancer and stuff.
Her child has a chronic disease, so she worries about repeated exposure to radiation.
He's always like sick because he has asthma, so he's gonna like 2 or 3 x-rays.
The effects of x-rays in children is a controversial subject for many, as there are no concrete studies to show the long-term effects that the test can have on a little body.
I think there is some misinformation sometimes for part of the population and then for part of the news. Indeed, as doctors, we should protect the children as much as we can, and because radiation is harmful for human beings, particularly children.
Radiologist Dr. Fabio Paez says minimizing exposure to children is critical.
As an adult, most of our cells are dormant. They are not growing. So the harmful effects of the radiation are the most when the cells are dividing, when the cells are growing. So there is a higher risk of radiation exposure in children because their cells are growing, compared to adults where the cells are dormant.
At Community Health of South Florida, doctors are very careful to study each case and only prescribe an x-ray when it is necessary. Minimizing exposure is important, but so is the potential to save a life.
In the process of diagnosing the disease, so the utilization of CT scan has been proven to be able to diagnose disease faster and more accurately.
We are all exposed to radiation in our everyday lives.
We're exposed to cosmic radiation. We're exposed to radiation coming from the soil. So as long as we keep that exposure the minimal as possible, we try to prevent further effects or harmful effects of the radiation.
Dr. Paez also says the amount of radiation from one x-ray on a child is not a lot.
An x-ray on a children has such a small dose of radiation that's it's like 1/10 or 1%, up to 1% of the dose that you get on a regular daily basis in 1 year period, for example.
CAT scans are another tool used to diagnose children, but they do result in more exposure to radiation than x-rays.
But there are situations that they are necessary. So the CT scan can, again, as I mentioned before, save a life of a child when it's performed with an appropriate indication. In the end, it's always a matter of measuring the risks and benefits. If a kid needs 3 CT scans because he has a dreadful disease that might kill him, he's going to have the 3 CT scans.
For Cecilia, it took some thought. She ultimately decided the value of the x-ray outweighed the risks.
I think it was worth it, just to know they were okay.
And that's what we all want, right? To know that we're going to be okay at the end of a doctor's visit. But some of us want instant relief, and sometimes that is not always the best remedy. There's nothing like waiting for an illness to pass, and for Garfield Williams, the wait has been unbearable.
If you're the doctor, you're supposed to have the answers. I need solution right now. I can't bear it any longer. So if you're going to tell me to wait, it doesn't make any sense to me.
The problem is sometimes there is no magic pill, and all you can do is wait for your body to fight the cold. Some patients believe antibiotics are the cure-all, but urgent care physician Dr. Charles Ross says that is not the case.
Most of your average colds, your sore throat, runny nose, cough, I don't feel good, that usually doesn't require antibiotics. And there's a strong push in the medical community to stop giving antibiotics to everybody just because they think that that's what they need.
Turns out, over time, your body builds up a resistance to antibiotics, so that when you really need it the most, the drug becomes ineffective and you need stronger dosages. A difficult concept to accept in this here and now society.
They don't care about what's going to happen in 20 years. They want to feel better now. I can't tell you the number of people who have come in and said, I can't afford to be sick right now. And I'm thinking, well, no one's ever come in and said, thank God I got sick today. This is a good day to be sick.
Antibiotics have no effect on a virus and can actually hurt your chances of overcoming the virus.
But while on antibiotics, which kill both the good and the bad, there's bacteria in our body that helps us to fight off other infections. You killed those off, so now you're more susceptible to viruses and you get another viral illness 2 weeks later.
It happens all the time, and here at the urgent care center, doctors spend a lot of time explaining why sometimes it's better to wait it out.
And so they demand their antibiotic and they're not happy unless they get it. I still spend 10 minutes explaining why they shouldn't take it, and then I say, you know, here, if I haven't convinced you not to take it, then nobody is.
Even more alarming, Dr. Ross says some patients stockpile antibiotics from other countries. Different antibiotics treat different illnesses, and only a doctor knows which one works for which illness. But Ross says it's important to listen to your body. If you feel awful, go to the doctor. If you have a high fever, chances are you might really need an antibiotic.
I have a bad cough that I just cannot get rid of.
Sometimes there are other remedies that can help. Tylenol, ibuprofen, or antihistamines can help ease the pain and symptoms. For children under the age of 6, consult a doctor before giving any of those. And honey has been proven to be very helpful in soothing that sore throat and cough. But children under the age of 1 should not be given honey. For Williams, overusage of antibiotics might have been breaking his system down. Now he's back at the urgent care center asking for urgent help.
Especially if they've done it once and then 2 weeks later they got another antibiotic and they're like, I just can't get rid of this illness. You need to stop taking antibiotics.
Doctors are not the only ones who are very knowledgeable about the medications you take. In fact, pharmacists are playing a big role in medication management. So much so at CHI, they now have a special anticoagulation clinic. Ashton Dabriel is a new man. Despite bypass surgery, diabetes, and other health-related issues, he's managed to control his illness and make his body stronger.
So far, I appreciate what you guys are doing for me, and I hope this program in the future will help other people just like me, you know.
The 67-year-old CHI patient is participating in the anticoagulation clinic. Patients taking drugs called Warfarin or Coumadin need to be closely monitored. They're blood thinners designed to prevent blood from clotting, but either end of the spectrum can be dangerous.
The patients that we see have had a blood clot in the past. They're usually elderly patients that don't move a whole lot. So if you're laying down or you're sitting all day, your blood tends to pool in your legs. Your blood will then clot.
A clot that goes into the heart, lungs, or brain can be deadly, causing stroke or heart attack. And blood that's thinned out too much is also very dangerous.
Greater increased risk of bleeding. So even if they're brushing their teeth or shaving or if they nick themselves, it's very hard to stop the bleed. So it's important to keep them within 2 to 3. So it's safe for their heart so that they're not getting a clot, but also safe so that they're not just going to bleed out on the street.
That's why Dabriel and others come once a week to get their blood drawn.
That is a great improvement. I'm very happy to see that.
It's also a time that they receive one-on-one attention with pharmacists like Lucy Hoff.
But when she breaks it down to you on an everyday scale, well, then you know exactly what you're dealing with.
The pharmacist goes over it all, from the patient's diet, exercise, and all their medications. Over time, they build relationships week after week, one by one.
So you get to know their stories, you know, what they shouldn't be
Exactly.
doing, what they are.
And they tend to trust us a lot. When they go into the doctor's office, it can be very intimidating. They have these white coats. They come in, they don't have a lot of time. It's just in and out.
And when the pharmacist gets the lab test back, they gauge immediately if the medication is too strong or too weak and can adjust the dosage right there on the spot as needed. It's a delicate balance of TLC and precision that can make the world of a difference in the life of a patient like Gabriel.
And the program's been so successful, they're now trying to add even more hours to accommodate more patients. Well, that's going to do it for this edition of CHI News. I'm Tiffany Helberg. Don't go anywhere. We will be right back.